All right, well, this is a brain that has the vertebral arteries sort of cut off a little bit, quite a bit actually. But normally the vertebral arteries would be coming up from the foramen magnum, and they would be coming up alongside the medulla. And then they come onto the ventral surface and they fuse and form the basilar artery. And the basilar artery goes in the midline along the basilar pons up until the junction of the midbrain and the pons. And then the basilar artery divides into the two posterior cerebral arteries. The posterior cerebral arteries are connected to the internal carotid system through the posterior communicating artery, which is communicating the vertebral posterior cerebral artery to the internal carotid. The internal carotid artery then divides into the middle cerebral artery, which goes in the lateral fissure, and then anteriorly to the optic chiasm, it goes anteriorly into the superior longitudinal fissure. And those two are connected by a little anterior communicating artery, which is sort of broken here, but that's that. So, as we go back down to the vertebral system, it gives off branches, and again, since the vertebral artery is cut here, you can't see those branches directly, but you can see where the branches go. This is the posterior inferior cerebellar artery branches, and you can see it's supplying posterior inferior surface of cerebellum. That artery, as it comes off the vertebral artery, will also give off a branch, the posterior spinal artery, on either side, and that would be coming right down in here and coming the posterior lateral sulcus as it comes down and goes down through the supply the spinal cord, upper cervical region of the spinal cord as well. So you can't see those on here, but those would be the posterior spinal arteries coming down. On occasion, those come directly off the vertebral artery laterally, but most often they come off the posterior inferior cerebellar artery. Okay, medially, about that same region, would be branches off from the medial surface of the vertebral artery, and immediately those are both called the anterior spinal arteries, and they immediately fuse to form one that would go down the center of the ventral surface, which is the anterior median sulcus. So the blood vessel that travels in the anterior median sulcus is the single one anterior spinal artery. Okay, so then we come up here where the junction of the medulla and the pons and the two vertebral arteries fuse and form the basilar artery, and they give off a branch. The basilar artery gives off a branch on either side as the anterior inferior cerebellar artery. And you can see this branch is coming down here and going to the anterior inferior surface of the cerebellum here. So that's the anterior inferior cerebellar artery here. On this side, this is probably it here. And if you follow that out, you see a branch. And one of these branches is likely the labyrinthine artery, which is going to go along with the eighth nerve and go in through the internal acoustic meatus to supply the labyrinth, the inner ear. So sometimes the labyrinthine artery comes off directly off from the basilar artery, but most of the time it comes off the branch of the anterior inferior cerebellar artery. The other little branches that are coming off the basilar artery all along the basilar region, midline basilar region, are the pontine branches or pontine arteries, and they will go either directly into the medial surface of the paramedian arteries, or they'll go a little bit further distance, so they're short circumferential branches, or they go all the way around to the dorsal surface, so they're long circumferential branches. And but we can just call them pontine arteries, and that's fine. So then you come up to the junction of the pons and the midbrain, and the big artery that you see on either side given off there is the superior cerebellar artery. And the superior cerebellar artery supplies the superior surface, which is that nice smooth surface on the cerebellum, just below the tentorium cerebelli. And then the tentorium cerebelli would be coming right up here between the superior cerebellar artery branches and the posterior cerebral artery branch. So the superior cerebellar artery is infratentorial, the posterior cerebral artery is supratentorial. and coming out between those two arteries would be the third nerve if it were present here, which it isn't. But that would be exiting from the antipeduncular fossa region, and that's right there, obviously, and so it would be coming straight out between those two arteries, which is a good landmark as well. Then we have the connection with the internal carotid system. So this is the posterior communicating artery, which would be communicating with the posterior cerebral artery. On this side it's missing, but you can see the hole where it was connecting to the posterior cerebral artery. And then the internal carotid artery goes into the middle cerebral artery, into the lateral fissure, and branches into the anterior cerebral artery, anterior to the optic chiasm, into the longitudinal fissure. In addition, you see the anterior choroidal artery. So here's the posterior communicating artery, and right next to that, just lateral to that, is the anterior choroidal artery that you can see going deep into the anterior temporal region and into the cerebral hemisphere above that region as well, so the frontal region and the parietal region, supplying those posterior structures there of the diencephalon areas. So those, that is just right opposite the division of where the middle and anterior cerebral artery are separating, so you can call that either branches of the middle cerebral artery or the internal carotid, whichever. There's going to be variations, like it's right there at the junction, so it's a moot point, sort of. Okay, the anterior communicating artery, again, connects the two anterior arteries. On this particular specimen, you can see this is the anterior cerebral artery of the right side here, and right there you can see how it's constricted. So it's all big there, and then all of a sudden it constricts right there. So there must have been some clot or something that happened right there. And then this connection is right here, is broken, but that's where that connection of the anterior communicating artery would be to this side, right there at the longitudinal fissure. It doesn't have to be very big because the longitudinal space isn't very big, so it just has to communicate from side to side. And that's the circle of Willis, the anterior communicating, the two anterior cerebral, the two internal carotids, the two posterior communicatings, and the two posterior cerebral arteries. That's it.